Okay, the final screencast. We'll talk about fusions and CYSTS, and then I have a number of videos for you to look at. They're just brief, little, couple of minutes each at the end. So basically, all the fusions of all of those parts that we talked about will begin to take place, and the only openings that we want once everything is completed are two nostrils and a mouth. All the other parts of the face are to fuse in one way or the other. If they don't fuse, we have variations of lack of fusions, and they're mostly called clefts. For example, if we have the right and left sides of the medial palatine process is supposed to fuse with the right and left sides of the maxillary process. If we don't have fusion, we'll have a cleft lip. In the palate, if the palatine shelves don't fuse to each other or don't fuse to the medial palatine process, which includes the premaxilla or the nasal septum, we will have a cleft palate. And there's variations of that. All of the palatal fusions are usually complete by the 12th week. So, and they can be, I'll show you some examples of partial and unilateral, etc. If the maxillary mandibular processes, the corners of the mouth fuse together, the maxillary and mandibular, will determine the size of the opening. Failure of fusion will cause a macrostomia, or a large mouth, and too much fusion will cause a microstomia, or small mouth. So here are some examples of some clefts, and starting with the unilateral, meaning just on one side of the midline. So in this case, this is a unilateral cleft palate, soft palate only. And below it, we have a bilateral cleft, soft palate only. Next to that, unilateral cleft lip, and just the lip. So that's where the medial palatine or nasal process, doesn't fuse with the maxillary process here. Down and below it, we have a bilateral cleft lip only. So it's on both sides of the philtrum and the anterior lip. On C, we have a unilateral cleft lip and palate. So you can see the beginning of that Y-shaped fusion. On the one below it, we have a bilateral cleft lip and palate. And it's a partial palate, so it doesn't go all the way. On the D, we have a unilateral cleft lip and full palate. And on H, we have a bilateral cleft lip and full palate right through to the uvula. So you can see there are lots of variations of this. Here's another view. This is like an impression version of a cleft. Here we have a cleft uvula. This is just a cleft lip. This is a cleft lip and palate, unilateral. D is a bilateral cleft lip and palate. So here we're looking at the nasal septum in the middle, and the shelves did not fuse at all. And here are some sweet little babies that have had surgery to help close the clefts. Some of them, this one particular has. This one has not had the surgery yet, and it is a unilateral cleft lip and palate. You can see the tongue through there. The next picture has it's a bilateral cleft lip and palate. This is a prosthetic device that is created so that the baby can properly feed, and this string is a safety device so that she or he cannot swallow it. Here's an unusual where the medial nasal process did not form properly. So it's a midline cleft, very unusual. Here we have a unilateral full cleft lip and palate, and just a cleft palate on this one. And this is a cleft on the mandible. Now, something that is very unusual and is called an oblique facial cleft, where the maxillary process and the lateral nasal process doesn't fuse. It's very rare. There is a video that shows a little fella that had a complete facial cleft that is on your blackboard shell. The occurrence of cleft lip and palate. It occurs in 1 in 750 live births. It's twice more common to have unilateral than a bilateral. It happens more often on the left than the right side. In males, more often than females. And the causes, a lot of it is unknown, but they feel that genetics accounts for about 30% of all the clefts. And then environmental, like pollution, smoking, alcohol, and a lot we don't know about why they are caused. The treatments are becoming more unique. They're actually doing some in utero surgeries that I was reading about, and they're just at the early stages of development right now. But if they can close these clefts early on in development, and some of them they know well ahead of delivery that the cleft has occurred. If they can close them before the baby's born, then the chances of them developing and healing properly and growing into their proper tissues are greater. So usually in the first 5 months, they will use orthopedics like that little appliance, and they'll make special nursing bottles and nipples and stuff like that for babies, mostly concerned with their breathing and ability to eat. At 5 to 6 months, they'll do their first lip and nose surgery. One of the videos, that the animation one that is on your blackboard shell, shows like a little zigzag version surgery, so that the tissues kind of zigzag together, and they get a nicer finish in the end. It looks quite nice when it heals. If the palate is involved, they start doing that between 12 and 14 months. And the nose and lip revisions and modifications, so like plastic surgery, they'll do between 5 and 6 years, if they're lucky. The other thing that we are concerned about in dentistry are cysts, in particular epithelial cysts, because of all of those epithelial tissues, the ectoderm tissues merging together, and the possibility of epithelial cells becoming trapped in those lines of fusion. They can sometimes become surrounded and embedded, which is often why we see cysts in areas of lines of fusion, like the upper lip beside the philtrum, at the corners of the mouth, the middle of the chin. A common example is what is called the nasopalatine canal cyst. And I think when you take pathology, you'll learn about some of these cysts. There's so many different ones that I won't get into it. Another one that we commonly see, and we don't commonly see it, but that is the result of where the thyroid gland descends into the neck. Remnants of those epithelial cells from that thyroglossal duct will break up, and either those cells or thyroid gland tissue is left behind, and we'll start to see a midline swelling just around the hyoid bone. So it's something to be watching for. All right, so now you can go to the rest of the video clips and entertain yourselves by taking a look at those, and I will be posting the test number 2 online, so you will have your books to use for this test, and you can do that. It won't be posted until next Wednesday, so you have the next week to go over everything and look at these screencasts as you wish. Okay.